Good morning, everyone. I am Dr. Faisal Abdullah from Bangladesh, and today we will discuss the radiological findings of ankylosing spondylitis. We shall discuss the radiological findings in two joints. First, the sacroiliac joint, and then we will discuss the findings in the spine. So first, let's study the sacroiliac joint. The first and foremost thing to know is bilateral symmetrical sacroiliitis is the hallmark of ankylosing spondylitis. This sacroiliitis has got some characteristic radiological features. First of all, there is fuzziness of joint margin. What does that mean? Well, every joint has got a sharp outline. In case of ankylosing spondylitis, this sharp outline is lost. The joint becomes irregular. And there is loss of cortical margins. This is called fuzziness. After that, erosion starts, usually on the iliac side of the joint, which causes widening of the joint space. After that, there is sclerosis, and sclerosis makes the joint space narrower. And in advanced stage, the sacroiliac joint gets fused, which is known as complete ankylosis. So now we shall discuss each of these characteristic features with their individual x-rays. First of all, there was irregular fuzzy outline. Here, look at this x-ray. You can see that this joint and this joint here, the joint margins are not sharp. It has become irregular. This usually occurs as the first finding of ankylosing spondylitis. This is called fuzziness of sacroiliac joints. After that, erosion occurs, which causes joint widening, and after that, sclerosis occurs, which causes joint space narrowing. And this sclerosis usually starts at the iliac side of the sacroiliac joint. What does that mean? Let's see. It is a sacroiliac joint. Here, two bones are involved. First of all, this is the sacrum, and then there is the ilium from the hip bone. So, this is the joint. We can say that this is the sacral part of the sacroiliac joint, and this is the iliac side of the sacroiliac joint. So we want to say that sclerosis starts in the iliac side. Sclerosis starts in here, and in later stages the sacral part also gets sclerosed, but you should always remember that sclerosis starts in the iliac side. Here, look at this x-ray, the left one. Here there is widening of joint space, and in the upper part there is narrowing. At the same time, here the white part is the sclerosed area. In advanced stages, there is fusion of sacroiliac joint, which is known as ankylosis. So we have shown two x-rays here so that you can compare. This is the normal x-ray and this is the x-ray from ankylosing spondylitis. Here you can easily see the joint margin, but here there is no joint margin. The joint has become fused. You can't say that there was a joint in here. This is called ankylosis, and this occurs in very advanced stages of ankylosing spondylitis. Now, we have discussed about 4 or 5 radiological features. These features can be used to make a grading of the ankylosing spondylitis. We can grade the sacroiliitis according to these features. This is called the New York criteria. Grade 0 means normal sacroiliac joints. Grade 1 means there is some blurring of the joint margins, that is suspicious for sacroiliitis. Grade 2 means there is minimal sclerosis with some erosion. Grade 3 means definite sclerosis on both sides of the joint, as well as severe erosion with widening of joint space with or without ankylosis. And grade 4 means complete ankylosis. Now, let's see some examples. This is grade 0, normal findings. You can easily see the joint margins in here and there is no sclerosis or ankylosis. This is an X-ray of grade 1 sacroiliitis. Here, there are suspicious changes in the left sacroiliac joints. Here, the joint facets have become irregular. This is grade 2. Here, you can see some small erosions and there is also some sclerosis. The erosion have been shown in black arrow and the sclerosis have been shown in the white arrows. This is an X-ray of grade 3 sacroiliitis. Here there is erosion, sclerosis, and also there is widening of the sacroiliac joints. I think all of us can diagnose this one. Here there is complete ankylosis of both sacroiliac joints. You cannot say that there was a joint in here. X-ray findings in the spine. In spine we can find a lot of findings. There is the shiny corner sign, there is vertebral body squaring, there is dagger spine appearance, there is trolley track sign, and at last there is bamboo spine appearance. Now let's get into each of them. First of all, there is the shiny corner sign. It is usually seen in lateral views. Here, reactive sclerosis occurs in the superior and inferior end plate of the anterior margin of the vertebral body. Let's make it clear. This is a vertebra and this one is the anterior margin. This is the superior end plate and this is the inferior end plate. Sclerosis occurs in here and in here and it looks like a triangle. Look at this area. This is the area of shiny corner sign. You can see it clearly here. Look at here. Look at here. This is called the shiny corner sign or the ivory corner. It is also visible in MRI. Vertebral body squaring. First, look at a normal vertebral body. In a normal vertebra, the anterior border is concave. It's not straight. It's curved like this one. But in case of ankylosing spondylitis, the concavity is lost and the anterior border becomes straight. So this looks like a square and this is called vertebral body squaring. Then there is the important dagger sign. What is dagger sign? Let me say it very clearly. The spine looks like a dagger. This is called a dagger sign. This white part, this is the dagger sign. Now, why does this dagger sign appear? This appears due to ossification of the supraspinous and the interspinous ligament, which creates a solid midline vertical density. Now, let's see what is the supraspinous ligament and what is the interspinous ligament. Okay, here I've shown a spine, an anatomical figure, and this is the spinous process. This long ligament, it is the supraspinous ligament, and the ligament between two adjacent spinous process is called the interspinous ligament. These two ligaments become ossified and this is seen as the dagger sign. Now, syndesmophyte formation. What is syndesmophyte? This is syndesmophyte. This is syndesmophyte. Now let me explain. For example, say this is a vertebra, this is another vertebra, and this is another vertebra. In between two vertebrae, there are intervertebral discs. There is no connection between this. Intervertebral disc has two parts. The central part is called the nucleus pulposus and the peripheral part is called the annulus fibrosus. The outermost fibers of the annulus fibrosus is called Sharp's fibers. This Sharp's fiber gets ossified and it is visible in the X-ray as this line. See this line. These are called syndesmophytes. In lateral view, these are the syndesmophytes. Now, there is a confusion. Syndesmophytes are seen both in ankylosing spondylitis and in psoriatic arthritis. So, how can we differentiate between them? Very simple. In case of ankylosing spondylitis, the syndesmophyte is fine, symmetrical and marginal. But in case of psoriatic arthritis, it is coarse, it is asymmetrical and it is non-marginal. Let me explain. Say this is the ankylosing spondylitis. Here you see this is a sharp line, a fine line. There is no coarse thing here. But in psoriatic arthritis, see here and here. Can you see the difference? It's coarse, it's not sharp, it's asymmetrical. This part and this part doesn't look the same and it is non-marginal. What does non-marginal means? Say this is a vertebra, this is a vertebra and this is another one. Marginal means this one. Non-marginal means it starts from the middle. Here you can see this is the vertebra and it starts from here. But in case of ankylosing spondylitis, the syndesmophyte starts from the margin of the vertebral body, not from the middle. Bamboo spine appearance. It is seen in advanced ankylosing spondylitis. It occurs due to a combination of syndesmophytes, ossification of anterior longitudinal ligament and facet joint fusion. When the whole spine syndesmophyte develops and ossification occurs, it looks like a bamboo. This is called the bamboo spine appearance. It is also found in advanced ankylosing spondylitis. There is another thing, trolley track sign. I haven't read about it in any books. I found it in Radiopedia. In the middle, this is called the dagger sign. When there is two vertical lines lateral to the dagger signs due to ossification of apophyseal joint capsule, there are three lines in the spine which looks like a trolley track. This is called the trolley track sign. Very easy, very simple.